the health sector. And may I start by saying that the Member of Parliament is acting within his mandate. We are elected to make laws and amend them when it's necessary. If you look at the response given by the ministry, it is as if the Member of Parliament is seeking favor to bring about the amendment. May I say this amendment is in good faith. It is good for our people. It is good for this country. And by doing so, the Member of Parliament is only trying to help or assist the ministry in what they have not been able to do for the last 9 years. They are admitting, yes, this is a very important amendment that should come up, but since 2014, they have not been able to do so. My question is, for how long shall Kenyans suffer because of laxity or inefficiency, ineffectiveness of our civil servants? And therefore, it begs on us as members of Parliament to take our responsibilities seriously, because whichever way, our duty, why we are elected, is to come and do exactly that, to ensure that our people are not suffering. We should even be able not only to push on how our patients are referred, but even ask ourselves, how much can this government spend to ensure there is a workable referral hospital in every county in this country? Ensure that every county is properly facilitated so that this movement is even curtailed, that referrals are only made within the county, because all the 47 counties can have workable institutions that can be able to handle these emergencies. We are even going to push further by asking ourselves several questions. I heard Wamushoba say that in our county, a patient was to be referred, but they could not even move her because they even didn't have money or means of transporting them. In my own county, a week ago, a house was burned down, 4 members were victims, 3 died instantly, and 1 was to be referred to Kenyatta National Hospital. It took almost 8 hours to refer this patient. By the time he arrived in Nairobi, he was pronounced dead. 8 hours was enough to save the life of this gentleman. But because we have no means of ensuring that we handle emergencies, Kenyans are really suffering. And therefore, it will be important for us even to bring up amendments, ensure that emergencies are emergencies. Nobody knew that that house will be burned on that night. Nobody ever can predict when they will have accident. And therefore, it is also important to ensure that we have either subsidized facilities or we can be able to have free transportation, free referral to emergency cases in this country. And those are some of the areas that we should be able to explore as members of Parliament to ensure that the people, poor people in this country are not continue suffering because they are not well endowed and they are financially not stable. We should also be able to ensure that we gazette all the institutions that are qualified to handle emergency cases and referral cases. Because again, you can see what the member is asking for is that we ensure that adequate measures are taken to establish whether the health institutions to which patients are referred to within and outside the country possesses adequate health equipment and health personnel. These are issues that should be done early enough. Let us gazette all the private institutions, county and national government facilities that can be able to handle referral cases to ensure that it's efficiency, that our patients are being referred not to favor a certain institution, not to favor a certain Dr. Fred or a certain doctor, but because these facilities qualifies to handle these cases. And therefore, Mr. Speaker, what you'll be asking is to carry a comprehensive reform in the health sector and also ensure that, again, the debate is once again introduced, either through a national conversation once again, and that is why we are talking of reforms in this country. That is why we are talking of even having a referendum in this country, because there are some of these issues that now need to be discussed once again. There are counties that are willing to hand over their facilities to national government, but the mechanism to do so must be properly established. We have to ask ourselves, is it the high time to look at the issue in the Constitution on health issues that are affecting our people? If you look at the most important things that any government can do for its people, is first of all to ensure that they are properly fed, ensure that they have proper education, but above all, health care in any country is so important, Mr. Speaker. And therefore, I have no reason that we should be able to support this amendment and ensure that any institution that is serious, they should not wait until members of parliament brings amendments to come and tell us that we are in the process of doing so. Let them come together. If they have a better way of doing so, let them bring the ideas, what they need to be done, to the member who is capable, and we can be able to amend the law accordingly. I thank you, Mr. Speaker.
Very well. Let me acknowledge and seated